to demonstrate here the use of the Zeo 3-step peel, which is the stronger peel than the red carpet which we demonstrated on our other video. So we're going to start with 8ml of the fluid, and we're going to paint this on in an even manner, and then when that's done it's going to be followed by a dose of the retinol, and then after that we will, because it will be stinging, we're going to use the calming cream. So we use the liquid until either the 8ml is used, or in some cases if the patient thinks it's getting a bit hot, we would stop earlier. So I'm just going to move Leslie Ann's hair so I don't get that involved, and we'll start at the top. Here we go. So as you can see, it needs to be applied right down to the jawline, and it also needs to be just feathered in below the jawline, because what we don't want is to be left with a line where the skin is being peeled and you can see where it hasn't been peeled, hence the feathering in motion. We're going under the eye, we're obviously not going onto the eyelid, but we can get down, as I will do in a second, right down to the brows like this. We can come down the centre and onto the nose. A standard peel, everything is done equally. We'll go all over the face. You can see from my gauze that there's some makeup on it. It doesn't matter that Leslie Ann got some makeup on, because this will soon penetrate through it. It makes no difference at all. We're putting it on in as many layers as we can. I've got through half the bottle now. I'm trying to go into the nasal folds here now, because that's another place that the skin quality can be affected. Under the nose, but being careful not to get into the nostril or onto the lip itself. Another coat on my side. Now Leslie Ann's skin is actually quite even, so I'm doing, as you can see, everywhere the same. But some people have problem areas, and if there was a problem area, which could be, for example, pigmentation, or in my case I have an area that's particularly dry and sheds the skin a lot, you can concentrate on that area, but it's important that you still do the whole face, even if you have to concentrate more on one area. So we could do a more focused peel by doing that. Now I'm not sure if it's possible to see on the camera, but Leslie Ann's skin is now starting to go white. And what that means is that the acid has penetrated through the dead layer of the skin. There we are. Through the dead layer of the skin, and is now starting to touch what's called the papillary dermis, which is the first part of the living layer of the skin. And that, when the acid touches that, it coagulates the protein of that, because that bit's alive, and it starts to go white, and that tells me I've reached the required depth. I've also virtually run out of the stuff. So I'll put my last layer on, I'll make sure I've got the feathering again, and then we're going to go for the retinol. I'm just going to go and find some scissors. So it's not quite like Blue Peter, is it? Because I should have had those scissors ready. And now we're going to put the retinol cream on. In a second I'll be doing that with both hands. You can probably see that Leslie Ann's skin gone a little bit red. Now it's not bright red, it doesn't look dreadful, and we'll be able to see in a few minutes what this skin will look like when the peel is complete, that it's not so dreadful that people are worried about going out and being seen after they leave the consultation. So cream going in. Just need to rub the rest of that in before we start on the calming cream. Leslie, how warm is that feeling to you?
That's about an 8.
8 out of 10, where 10 would be the unbearable.
Yes.
Yeah?
Yeah.
Yeah. So it is quite hot, and I have to say I've had the same treatment. So you know, we like to be honest with patients here. It is hot, and this bit is no fun. But as you can see, it's not unbearable, but yet it is warm. Now, calming cream. The purpose of this is obvious, to calm down the heat. But this cream isn't used just for once. This cream is given to the patient to take home and to continue to use for a few days. The purpose of that is to try and keep the skin on the face for as long as possible. What I mean by that is, probably by tomorrow night, Leslie Ann will feel that the skin is feeling quite tight. It starts to feel a bit tight around the face. It can change in colour, it can darken, as the surface of the skin, of course, has been killed by this treatment. Get some on the nose. And it's going to peel off. So the first thing it does before it peels is it goes tight and sometimes changes colour. And then tomorrow night or the morning after, it will be really quite firm, tight, and will peel. It will crack at some point, and then it peels off in sheets. It's not like dandruff, like a mild peel. It does come off in sheets, leaving pink, quite immature skin underneath. And that is why we recommend that you use a high factor SPF thereafter, because the skin is more susceptible to burns. In some cases, let's put all of the cream on, in some cases after the peel, and it certainly happened in my case, the following day the skin went a bit tight and shiny again, and there was a small secondary peel, leaving the face a little bit pink, but no big deal. It wasn't something there where I wouldn't go out. And after that there might be little bits which haven't quite come off, because what we strongly recommend is if there's a bit that's peeling off, don't pull it off, because the bit that's stuck on isn't ready, and you may expose some completely immature skin and there'd be a risk of scarring. So let it come off on its own. So timings then, as I've just said, today should be a bit red. I'll clean this off in a minute and we'll have a look. Tomorrow night it's going to go tight, a little bit dark. Tomorrow night by morning it will probably peel off or start peeling off by the end of that day, and then there may be a secondary peel the day after, there may not. And after that it's just a case of continuing to use the calming cream, which we will give you to take home, just to keep using it as much as possible. The longer the dead skin stays attached to the face, the better, because we want the new skin underneath to mature before it's exposed. And then afterwards the skin is very smooth indeed. It's sensitive to light, as I said, so you must wear an SPF. It's a huge improvement. So then we will also recommend the necessary products to keep it like that. We will also talk to you about whether further peels are necessary or just the one. And I think in most cases just the one is sufficient, unless there's some serious reason why we need to do more. For example, if there were chloasma or melasma, those are the pigmentations. They normally occur in this area or in this area here, and it may be that more than one peel is necessary to clear a deep melasma. But we'll talk about that to you if you come for a consultation. And the other thing is, of course, acne scarring, which may be deeper. But if I now ask Leslie Ann what the score is, what's the score?
0.
We're down to 0 already. So you're feeling comfortable?
Yeah, it's fine.
So I will dry your face off, and then we're all set to go. Okay, so that's the end of the demonstration. That was the Zeo 3-step peel demonstrated here at Select Medical. Right, I'll cut it at that bit. She took the whole lot.
Do you know what the worst thing was at first? It was the smell of it.
Was it?
I felt I couldn't breathe. And this was useless.